Good morning, Madam Hearing Officer. For the record, my name is Brian Lanoue, Connecticut State Representative from District 45, representing 5 towns in eastern Connecticut. My written testimony will be forthcoming in the next couple of days. But I'm here to speak specifically about, in person, regarding the proposal before us to essentially prevent or not mandate life-saving care for a baby who survives an abortion, who is now outside the womb and is alive. As you all know, on my opening day, I swore an oath before God and the people of Connecticut to protect and defend the Constitution of Connecticut and the United States. That includes life being number one. Our founding fathers, through their wisdom, had 3 co-equal branches of government of checks and balances. Clearly, what we have before us here, I think, requires legislative deliberation, a passage of a law that needs to go through the House, the Senate, and have the signature or veto of a governor. What I'm looking at here, Madam Hearing Officer, is my understanding the arguments for a basis for an abortion is to terminate a pregnancy, end the pregnancy, and separate the fetus or the baby from the womb. Terminate that pregnancy. As soon as that baby is out of the womb, that pregnancy is over. The pregnancy is terminated, mission accomplished. At that point, if that baby is alive, that baby is breathing, and outside the womb it has a sign of life, maybe still a heartbeat, maybe the feet and the legs are kicking, the hands are moving. To me, that baby has the right to live. Why, at that point, what incentive could there possibly be not to provide life-saving care to that baby who is outside the womb? Quite frankly, I don't understand the difference between a baby who's born alive in that situation and a baby that is perhaps dropped at the front doorstep of a medical clinic or hospital. How that's a newborn. What's the difference between those 2 sets of babies at that point? Clearly, Madam Hearing Officer, there's a lot of deliberation and debate that needs to happen. It needs to go. This needs to be decided. This needs to be debated. With all due respect to the Department of Public Health and this assembly, it needs to go before the General Assembly, the People's House, people who are elected, people like me. And that's where we need to have our deliberations. That's where we need to have the arguments. That's where this needs to be vetted out, where all 187 House members and senators need to have this discussion. Thank you very much. Thank you, Madam Hearing Officer. Appreciate it.